Hello, I'm Max Garcia. This is my video submission for NU 550 Healthcare Policy: The Difference Between Policy and Politics. Policy is a decision made by a governing body, and policy is shaped by politics. On the other hand, politics use influential relationships to gain power over the ability to create policy. Politics determine policy. Politics is the arena where power plays and decision making play out. And lastly, politics cannot be ignored in policy making. You must play the game. Determinants of policy are the social determinants of health, which include community, socioeconomic, employment, education, and healthcare system factors. Mason et al., 2021. Policies may be discriminatory, favoring one group over another. The ACA is an example of a federal healthcare policy that, although it grants us all access to coverage, it doesn't mean that we all have access to care. Again, that can be influenced by your location, your socioeconomic status, your education, whether or not there are clinics near you. Mason et al., 2021. Politics, on the other hand, are influenced by financial factors, popularity, and often public opinion. It's a popularity contest. And with our current system, there is a lot of partisan bias. We know that in politics, the policies are not always aligned with the public's best interest, such as the repeal of the Affordable Care Act or the attempt. That feels less like a beneficial endeavor and more like a personal vendetta. Let's move on to my opinion of the political process. On the pro side, I do find it very exciting to exercise my constitutional rights, especially voting. That is a fabulous feeling to go and vote for elected officials. It gives a sense of patriotism. I also have recently gone to a couple of protests and rallies where I found an unexpected sense of community. On the con side, I think the political process can be quite despicable, especially in current times. I also used to have apathy towards politics. At one point, I didn't even vote. But as with many nurses, there's often a triggering event. And this was written in Wilson et al., 2021. And my triggering event was the Obama election. I saw an opportunity to get some equity at the national level. Also, I have begun to lose faith in the political process and our elected officials. I've even started to lose faith in the reliability of the Constitution. Moving on, how can nursing schools better prepare students to participate in healthcare policy? Well, we teach nursing students that they must advocate for their patients. And that, in and of itself, is a political act. So we could do better to teach students that being a nurse, in and of itself, is political. We should also seek more curricular content, more speakers. In fact, at the Baker University School of Nursing, one of the clinical days, the fourth semester students will be going to the Capitol in Topeka and speaking with legislators. Also, we could add more mock scenarios, such as provider disputes, shared governance meetings, etc. And we can instill pride in nursing students regarding the political nature of our profession. Finally, what would happen if nurses become more involved in politics? Well, on the pro side, there would be more activism. We might see more effective policies that address the broader good. We might see more cohesion amongst RNs. This might even lead to a possible unionization of the workforce. And from there, we may even see standardized wages, ratios, and education, which happens to be one of the larger criticisms aimed at our profession, the lack of standardized education. On the con side, getting more involved in politics could lead to corruption, discriminatory policies, and splitting into factions of the nursing workforce. To summarize, policies are made by politicians. Politicians compete for power and control of resources and the ability to create policy. Not all policies are designed for the greater good. As nurses, we can use our expertise and experience to influence policy decisions. The risk of political corruption is outweighed by the benefit of having our voices heard by getting involved. Nursing curriculum should do more to teach students an appreciation of policy and what the concept means. Nurses are expected to advocate. Advocacy is political. Therefore, nursing is political. Excuse me. If we don't speak up, then the policies will be made for us rather than with us. Thank you for listening.